that have to be done for any patient who is coming with chest pain?
Before we discussed the case in class, we used to take the case that the teacher gave us to home, and each one in the group prepared some questions. We had to do research, we had to go through the internet, through different websites. Of course, the websites had to be credible websites, and we had to base our research on evidence-based research. And then after each student collected the information for the question he or she is supposed to answer, we used to meet up in class as a group, and then we discussed the answers among the small group, and then with the whole class and with the teacher. And each student within the group had a specific role.
Okay. What does the background data provide us with?
So we as students, we were the primary source for information in the class. Since the instructor was just a facilitator, we had to give the information for the class. So we had to make sure that they are evidence-based and they are the right information. We had a group dynamic, so inside the group each had a role. Some students were the presenters, others the timekeeper, or others the leader. There are many interactions that occurred inside the group and as a class as a whole.
The class was divided into small groups as responsible of a certain question of the case. And then a representative of the group is supposed to answer that question in the most perfect way. And then the teacher will coordinate the questions, and we used to write them on the board so everyone can see them. And these were the final answers, so the teacher wouldn't add to them unless there was something wrong. So we were the ones putting the lectures, if you want to say like lectures. The class was so interactive, it was very busy. We had a lot of discussions in class. It wasn't a boring class since we were not listeners. We were the one participating and putting the input. We were active learners more than like passive learners.
So we were grouped with different students that sometimes we didn't know or we didn't work with previously, we weren't friends with. So this helped us to build connections and know how to work in a group and with different people. And this was really important later on in our nursing profession, since we worked with many people that we didn't know. We had to encounter, we had to learn how to face difficulties, how to face people with different opinions from our own. And sometimes we found that within the same group, we were the teacher and we were the students. So when our friend, the classmate, would ask a question, we were the one who would answer with the appropriate answer. And the same would go if I or someone else had a question. So we really learned how to work in teams and how to learn to listen and not just to hear someone talk.
The CBL sessions allowed us to bridge between the theory and the practice, since in our practicum and in our work-life experience, we encounter sometimes the same cases, so we remember the signs and the symptoms of the patient. Especially for me, since I'm working in the coronary care unit, I can remember the same cases we took with patients who had angina. I can remember the signs, the symptoms, the treatments, and even the lifestyle modification that the patient should have.
One of the strongest advantages of case-based learning is that it helped me later on in my nursing profession, since through case-based learning we learned how to tackle the patient holistically. Since in a case you're presented with a real situation where the patient already has other disease, where you have more than one risk factor, and you're presented you have to solve the disease going through the rest of the risk factors that the patient had. So while studying in a lecture situation, you're only studying about one disease process, about one situation, and this is different from the case-based learning where you integrate and you need to think more, you need to do more research in order to reach the solution for the problem. And this is the case in real life, since every time you get a patient, they differ in many situations from one patient to another, and this is much more helpful through case-based learning to learn how to deal with these situations than with the lecture-based learning.
The good thing about case-based learning is that it's the same case that we face in our clinical rotation. Since the patient comes and we don't know the diagnosis of the patient. Patients come with the different signs and symptoms, and then we start to find out what are the possible diagnoses that they might have. Then we start to plan the care that they should go through, just like the way we do in case-based learning. Then we try to research more about the diagnoses and about the medications so we can advance in the plan of care. This is a good part about case-based learning, since in the lectures you just know about the disease and the signs and symptoms that comes directly after the disease, which is different. It's a theory that is different from your practice. Another good thing about the case-based learning is that working in teams helps you more in your clinical rotation, since you are not working on your own and you are not always listening what others are saying or what others are doing. You are putting an effort in the final goal that you want to reach with the patient.
We recommend the case-based learning mostly in the cases that they are very common in our culture. For example, hypertension, breast cancer, anemia,
cardiac
diseases.
So these cases, they're usually common in our society, and they're usually they involve more than one disease, so they are related to other comorbid diseases. And using the case-based learning, it helps us relate more to these diseases,
since we encounter them more in our clinical settings.
However,
but the other diseases that we don't encounter in our culture, like the
maybe some rare cancers,
rare diseases or rare cancers, maybe it's good to pass through them like quickly in our lectures, so as not to take more time in elaborating on them and
through case-based learning. In general, we recommend CBL to be integrated in our nursing curriculum, especially in nursing, because it affects a lot our practice. And this is a very easy way to take our theory into our clinical rotations.
And it's a very good way in order to remember the cases and the signs and symptoms more than like being passive listeners in class.
And since some of us we do have we remember specific cases, as Yara said previous on, so we remember specific signs. Like we remember that in our class we took this case and the patient had these and these symptoms. So once we have such patient coming to us in the hospital, we directly relate. You have this connection in your brain to the case that we had in the class, and this is very beneficial.